Britain's Prince Charles has tested positive for the coronavirus. Clarence House says the heir to the throne has mild symptoms and remains in good health. Well, Ollie Barrett joins us now from London. Ollie, what do we know about the prince's condition? Will other royal family members have to also be tested?
Prince Charles, we are told, remains in good health. We're told by Clarence House that his symptoms are just mild in terms of what he is displaying at the moment. He is 71 years old, of course, and his wife is 72, the Duchess of Cornwall. So they are in that older category, which is considered to be higher risk for people with regards to the coronavirus. We're told by Clarence House that the Duchess of Cornwall, Camilla, has been tested and has tested negative. We are also being told that they are both now self-isolating separately in Balmoral in Scotland. Buckingham Palace says that the Queen remains in good health as well. Obviously a huge amount of concern for her and her husband Prince Philip, given that they are both well into their 90s. Buckingham Palace telling us that the last time that Prince Charles saw the Queen was on March the 12th. There's also some concern about the fact that the Queen and Prince Charles were both at a major church service in London, which was pretty crowded as an affair on March the 9th, at a time when we knew that there was an outbreak of the coronavirus here in the UK. So all sorts of concerns about the senior members of the royal family. The Queen and Prince Philip remain at Windsor with a very small amount of staff there, where they are being looked after and very much kept an eye on. As I say, Charles and Camilla up in Scotland, self-isolated in their house at Balmoral.
Ollie, tell us a bit about the reaction that's been to this announcement.
Yeah, of course, a great deal of concern being expressed for Prince Charles, but some relief at the fact that for now his symptoms are being described as mild. There is some controversy circulating, particularly on social media, about the fact that Prince Charles got tested for COVID-19, despite the fact that he's only displaying mild symptoms. The current NHS advice here in the UK is that people with mild symptoms that might be the coronavirus are not being routinely tested on the NHS. That said, Clarence House says that they were tested because they met the criteria required for testing. That may be to do with the fact that, as I say, Charles and Camilla are both into their 70s, so that may explain the testing. You also have to remember, of course, that Prince Charles is the heir to the British throne, so I think we shouldn't be surprised at the fact that he did get tested for COVID-19. But now that he is in isolation, certainly public activities from the senior royals were already being massively scaled back. It may be some time before Prince Charles is able to see his mother, the Queen.
All right, many thanks for that update. Ollie Barrett from London.